And I spoke with the Minister responsible for the juvenile justice system, Community Services Minister Lisa Neville. Lisa Neville, welcome to Stateline.
Good evening.
This is the third in a series of reports that the Ombudsman has released. The first was child protection, the second out-of-home care, and the third juvenile detention centres, all scathing of your department and therefore your government. Do you concede you've failed?
Look, I've always said these are, very difficult and complex areas of policy and practice. This is the Department of Human Services where we're dealing with some of the most complex people, some of the most complex issues. Obviously, these reports are important as a mechanism to help us continue to improve the way that we respond. But in all of those reports, particularly the child protection and the out-of-home care report, the Ombudsman acknowledged that there has been significant reform, and in fact that Victoria has done very well in our responses, but there was more to do.
Hanging points, exposed glass, staff and detainees electrocuted, unhygienic kitchens, bed sheets not changed between detainees, the prevalence of scabies and golden staph. Are these third world conditions?
Now, many of the issues of substance that the substantive issues that the Ombudsman raises are issues that Neil Comrie had raised and which we are currently addressing around security and safety. Then there are a whole range of anonymous allegations, because it's a whistleblower's report, of which all have been investigated, and some of them there is currently no evidence to substantiate.
The Ombudsman has had direct sworn evidence from internal witnesses. Are you doubting that?
So for example, there is an allegation in relation to staff members inciting fights amongst offenders, a very serious allegation that would be completely inappropriate behaviour. So that was not anything that Neil Comrie found evidence of. We have found no evidence of it. So we have asked the Ombudsman for any evidence about that. Those issues that the Ombudsman has raised where there's clearly been a breach, those are being addressed by the new management out there.
Why has it taken the Ombudsman to raise them? Why didn't your department for years do something about it?
Well, firstly, as I said, I had concerns early in the year, which is why a new management was put in.
Can I give you another example that was quite startling? For 10 years, the kitchens hadn't been inspected by health officials. 10 years, that's a decade that health officials haven't examined the kitchens. 10 years that you have been in government.
But last year we, in fact, undertook a food safety audit out at the Parkville facility, and as a result of that food safety audit have extended the catering contract. So we now have an external provider across the whole facility.
But my point is that these things have been allowed to fester for 10 years, and it's taken the Ombudsman to raise them for you to do anything about it.
Well, as I said, some of the food safety audit was undertaken last year. We've got new management in place earlier this year. So many of these issues, have been identified and commenced addressing. And of course, the Ombudsman has raised some other issues that, we've agreed with all the recommendations that he's made, are in the process of implementing.
Do you concede, and what's your reaction to the fact that the Ombudsman points out that your government's in breach of United Nations rules, Australian standards, health regulations, and your own Charter of Human Rights?
Well, so the issues that the Ombudsman refers to in relation to, human rights potential breaches relate to largely around the conditions, because of the nature of the detainees in the Eastern Hill unit, that is our most serious offenders, because it's a secure unit, do damage. So, for example, toothpaste in the fire detection system, the pulling off of PowerPoints off the walls, all of those issues, and the level of graffiti. So some of those issues are issues that the detainees have been involved in doing damage out there.
You're suggesting it's the detainees' fault?
I'm not saying it's their fault. I'm just pointing out that there is a lot of damage that is in fact done to the buildings out there from the detainees who are in the facility.
But hasn't that always been the case? this?
What I have said, however, to the management out there is I expect that damage to be repaired as quickly as possible, that people, that we can't let graffiti build up over a period of time, and that they have a responsibility as staff to ensure that the conditions are maintained out there, but secondly, that the detainees who might, for example, be doing graffiti should also be required to clean up that graffiti, and I think that's appropriate as well. In addition to that, we've put some funding into refurbishing completely that unit.
Do any of the detainees there have scabies or golden staph at the moment?
Look, obviously we do all we can to improve, and I expect this, to improve the hygiene of both offenders but also of the facility itself. Now, one of the downsides of institutions is that you have higher rates of infection. We have on site out there Royal Children's Hospital who provide both for physical and mental health needs of detainees, and so where those infections develop, obviously there is medical support that's available, as well as strategies to try and maintain and reduce the spread of those infections.
Will you allow our cameras to go in there to show the public?
Look, one of the issues, it is a detention centre. It is a custodial centre, and it has security issues.
Without identifying anyone, would you allow the cameras to go in there to show the public?
Look, I'm not sure that it is appropriate that cameras go in there.
Minister, thank you for your time.
Thank you, Josephine.